Hello, welcome everyone. Welcome to Your Health, Your Values, a conversation about honoring your wishes for care. My name is Tita Beatty, and I am presenting with Roshni Kavate. We are presenting this webinar in conjunction with the New York Public Library, as well as End of Life Choices, New York.
Welcome. We want to thank you for being with us today. Planning for care can be hard, and we appreciate the care that you are taking for your loved ones and that you are trying to help. Perhaps for some of you, you're at the beginning of a journey, while others you may be navigating toward the end with your loved ones. And we welcome all of you and hope we'll be of support to you today. We're honored to be working with End of Life Choices New York, the National Network of Libraries of Medicine, and your neighborhood library. Please be aware that with this video, there is a handout and a glossary of terms.
The future of health begins with you. This is a slide of the All of Us research program. And today's program is funded through an award from the National Network of Libraries of Medicine, Mid-Atlantic Region, a partner of the All of Us research program. Developed resources reported in this project are supported by the National Library of Medicine, National Institutes of Health, under cooperative agreement number UG4LM012342 with the University of Pittsburgh Health Sciences Library System. The content is solely the responsibility of the authors and does not necessarily represent the official views of the National Institutes of Health. The National Institutes of Health All of Us research program aims to build one of the largest, most diverse collection of data of its kind for health research. The goal is to have 1 million or more diverse volunteers nationwide who will sign up to share information over time. The goal of the program is to help researchers understand more about why people get sick or stay healthy. By looking for patterns, researchers may learn more about what affects people's health. The All of Us research program will be a resource for many different medical studies and is a cornerstone of the Precision Medical Initiative. To learn more about the All of Us research program, visit www.joinallofus.org/NLM.
This is a page of Medline Plus. It is the home of consumer health information from the National Library of Medicine. Imagine Medline Plus as your new health information Google. It has information in over 45 languages, and most importantly, it has no advertisements or endorsements. Medline Plus links to trusted resources, including the National Institutes of Health, the Center for Disease Control, Mayo Clinic, and Nemours Foundation. And this is an example of a health topic page. Right here is the end of life issues page, as you can see, and you can scroll down and browse around. It doesn't create its own information, but it gathers and organizes it. So rather than doing an internet research just to go to Mayo Clinic and then move over maybe to the American Academy of Pediatrics, you can come to Medline Plus. The information has gone through strict standards before it's been included, and the source is always cited. Again, we're looking at the end of life issues page here. There's a lot of interesting and useful links, including health concerns, links to local health experts, statistics, research, and more. I want to give you a brief introduction of End of Life Choices New York. End of Life Choices New York's mission, it seeks to expand end-of-life care options and improve end-of-life care for New Yorkers so they can have a good quality of life at the end of life and receive care that is in alignment with their wishes and values. The issues that End of Life Choices New York works on are about quality of healthcare choices, human rights, autonomy, justice, and the relief for suffering. A little bit of introduction about me. My name again is Roshni Kavate. I'm a palliative care registered nurse. And my wish for all families is that they get the freedom and support to live deeply vibrant and meaningful life. And I can hope I can do that by facilitating this with my professional experience as a palliative care nurse and share the profound ways in which I have witnessed families lovingly care for each other.
And again, my name is Tita Beatty, and I'm an elder care consultant as well as a death doula. Immigrants overcome so many challenges by the force of their sheer will and their belief. This project is important to honor their individual selves and to continue to respect what they want all the way until the end. My hope is to bring awareness to the importance of knowing values and wishes, as well as communicating them and making it possible to complete their lives fully. What brings us here is New York's vibrantly diverse immigrant community.
Why do we think end of life choices, New York, and this is important? Well, within immigrant communities and those of color, it's a fact that there are a lot of healthcare disparities. There are higher rates of chronic illness, higher mortality rates from cancer, higher rates of heart disease, kidney disease. And we see this right now with COVID. There's serious inequity when it comes to COVID. It's a very serious illness. It affects families who live together. It spreads very fast, and it has lifelong effects that linger for a very long time. And it's also very highly contagious. And what we've seen is the care that immigrants and again people of color are receiving is unequal, and the disease is also causing higher rates of illness in immigrant communities and folks of color. And again, even with the vaccine, we've seen that there has been inequities. So different groups receive different care based on race, ethnicity, and language. Currently, you may have also read that hospitals and medical teams are overwhelmed and they don't have a lot of time to give unless the condition is critical. In general, medical care provides a one size fits all solution, not one that is individualized or tailored to your culture. As experts, we want to guide you in navigating the healthcare system where your wishes and your values are honored in pursuit of the best care possible.
One of the causes of these disparities that Roshni highlighted is barriers to communication. There are stakeholders in the situation, and there are three. There's the individual who is also the patient, the individual's family, as well as the individual's medical team. In terms of barriers to communication between an individual and their family, those kinds of barriers may center around lack of knowledge, as well as culture, the internal culture of the family. The barriers to communication that the individual patient as well as their family may present to the medical team may also revolve around lack of knowledge, perhaps barriers around language, as well as cultural practices and beliefs. The medical team also may have their own barriers to communication, and that can revolve around the power dynamic of the doctor being the absolute authority figure, as well as the medical system viewpoint and any kind of cultural competency or lack of.
Our goals and intentions for our presentation are that you will learn about common themes and issues that immigrant families face. I hope you will learn how to advocate for your values, beliefs, and needs within the healthcare system, and that you will take away practical tools and resources for support and documenting wishes and values. Our intention for you is to feel empowered, that you operate from a sense of control, that you honor your family, and you celebrate your culture and your values. And we want you to feel that you'll have a sense of peace while advocating for your family. We want to introduce you to Mrs. X. So this is an example of a patient, but this could be anyone's story. We will be walking you through Mrs. X and her journey. And again, imagine this could be you, your partner, your children, your loved ones, your family, your friends. A little bit about her: she's 78 years old. She has diabetes and heart disease as her main medical illness, and she had a fall 2 years ago.
Mrs. X takes pride in caring for her house and her garden. She volunteers at her church and she loves to spend time with her family. Mrs. X's mobility is declining and she might need a cane. And then she asks you, her child, to drive her to her doctor's appointment. You agree and you start to wonder about how she's doing. Today, we're at the doctor's office, and with Mrs. X's story, we would like to show that there are different perspectives from the family side as well as the medical team side. From the family's perspective, the focus is on the personal experience today. And those kinds of issues arise in terms of questions around day-to-day activity and abilities, perhaps centering around pain, the ability to walk, as well as strength. Finances are a concern, as well as the level of independence that Mrs. X can sustain. Safety is important, as well as cultural considerations for the family.
From a medical team's perspective, they will be focusing on symptoms and how the disease is progressing. So they may ask, how is Mrs. X feeling today? How's her breathing? How's her blood pressure? What her medications that she's taking? And what activities is she able to comfortably participate in? They may ask about if the family's noticed any recent changes to her health and what her safety again is, if she has fallen recently. And they may also ask if there's a proxy decision maker for her.
So, what can you as a patient or a family member do to advocate for yourself? Advocate for your goals of care and communicate. Ask questions. Before the appointment, ask for an interpreter. Before the appointment, write down any questions that you might have so that you don't forget to ask. During the appointment, ask for additional information if you are unsure of anything. During the appointment, ask for information to be written down. And also ask about resources and if you can speak with a social worker.
And it's important to share what matters to you. So you may share, I want to know everything. What is important to me is transparency and communication between my family and the doctor. And what you worry about. You may worry about pain and not being able to walk. What I value most in life. What you value most in life is spending time with your children and your loved ones and being in conversation with them and having a good quality of life. And who do you tell? You tell everyone. You tell your spouse, family members, friends, your doctor, your gerontologist, the geriatric case manager, the social worker, and speak about your own wishes with your loved ones. And you can plan ahead by completing an advanced care directive.
What are advanced directives? Advanced directives are documents describing your healthcare wishes. An advanced directive protects your right to have your healthcare wishes respected if you lose the ability to communicate. There are types of common advanced directives. You may have heard of the healthcare proxy form, a living will and documentation of wishes, as well as a do not resuscitate or a DNR. We see that a lot on television. There's also something called the MOLST, which stands for Medical Orders for Life-Sustaining Treatment. All of this is important because if one day you become too sick to make decisions for yourself, then the most important people in your life will know what matters to you so they can make decisions that respect your values. Advanced care planning is not just for when you start to feel unwell, it's for everyone at any time. You never know where life will take you, and it's a gift to yourself and your family.
So this is an example of a healthcare proxy form. It reads, I, you would put your name here, hereby appoint your proxy's name, home address, and telephone number as my healthcare agent to make any and all healthcare decisions for me, except to the extent that I state otherwise. This proxy shall take effect only when and if I become unable to make my own healthcare decisions. In New York State, the healthcare proxy form is the most important advanced care directive. This form is important to complete because it ensures that your values and wishes will be known and honored if you become too sick to communicate your wishes. And we strongly recommend that everyone over 18 years of age or older should have a completed healthcare proxy form. So that's the first thing I'll be discussing. We will recommend that you review this healthcare proxy form anytime there's a death in the family, there's been a divorce, there's been a recent decline or an illness, there's a new diagnosis, or maybe even every decade, or if you think that you like to change your healthcare agent or your views are changed on what you prefer at the end of life. And you should give a copy of the completed healthcare proxy form to your healthcare agent so that they can actually prove that they are the healthcare agent. And it's also important to give copies to your doctor and your family members. And don't just put it in your safe or store it in a deposit bank or deposit box or put it in your home office. Because if you're unable to communicate, it might not be found right in time and it may not be used. So you may also wish to consider keeping it in a copy of it on your cell phone or in your wallet or in your purse. The New York State Healthcare Proxy Form is an advanced care planning form, and you fill out a healthcare proxy form with the name of someone you trust who will make healthcare decisions for you. And this person only acts as your healthcare agent when you're unable to make decisions for yourself. Again, it's very important to note they will only make decisions on your behalf when you are unable to make decisions for yourself. So this healthcare proxy form can also include information about your values, your wishes of care, and medical decision making. This form is a legal document you can obtain for free in multiple different languages at the End of Life Choices New York website, and you don't need a lawyer to fill it out, but you do need to have it witnessed by two different adults other than your agent. And again, this form is easy to update with your values and whenever your wishes change.
So back to our story of Mrs. X. The important question is, what do you want? And at this point, the things that may be important revolve around care, decision-making, and communication. In terms of care, it's necessary to determine and say what type of medical care is desirable, as well as seeking culturally appropriate and accessible care in the form of like a medical interpreter or foods. In terms of decision making, acknowledge how you and your family make decisions and do designate and communicate to that person to express your wishes if you cannot, and name them as your healthcare agent. And again, communicate. Please determine and state how information is needed and when, and what feels comfortable for you and your family. And if there are any critical religious beliefs or practices, please communicate that as well. So when filling out the New York Healthcare Proxy Form, it's important to share your wishes with the person that you choose to be your healthcare agent and the other important people in your life. So going on with our story of Mrs. X, now it's 3 years later, and she has had major heart surgery. So at this point, the family is focused, they have a pressing sense of urgency and worry, and they're most concerned with what is happening now, as well as where things are going. Questions arise around a prognosis, such as how much time does my mom have left? Can you give me specific numbers? Caregiving logistics, as well as the amount and level of care. Questions might be, who will take care of my mom at home? Will the hospital send someone to care for her? Because I can't take time off of work. There are also questions around finances. because it's important to know if insurance covers various services, as well as to understand who will pay for care. Decision making is also important. Sometimes families may think that it's necessary to do exactly as the doctor says, and there may be disagreements about quality of care, level of care. It's important to work out all of these issues, both with the individual as well as within the family. And all of that is necessary to communicate.
When it comes to the medical team, the focus will be on current symptoms, again, of how the breathing's going, how did the surgery go, and are there any effects from that? And also think about the future, how will this disease progress? So they may ask questions about symptoms. They may ask about the advanced care directive, like we talked about. They may ask, who do we talk to? Who will make decisions on your behalf? When it comes to goals of care and decision making and options, they may ask, have you thought about end of life care decisions? What would you like to do in a serious situation like needing CPR? Would you want a feeding tube? Would you want intubation? And when it comes to finances and caregiving logistics, they may introduce a social worker to help with financial support, insurance information, and community resources that could be helpful to the patient and the family. And when it comes to medical information, the medical team regards the patient as the most important person and that they would want them to know everything. They think it's unethical to withhold information. And you may also hear statements like, we will take care of you, you're taken care of. So there can be some confusion on what is the medical team offering. So when it comes to advocating for goals of care, again, communicating, asking questions, and sharing what matters to you, and thinking about, again, your goals and values and wishes. What is important? I want to stay home with my loved ones. I want to be able to breathe without pain. What is important to be is to be home and be able to garden. I worry about being in the hospital, being in and out of the hospital, or who will take care of me. So these are the kinds of questions to be thinking about. And this would be a great time as a family member to advocate and ask for a palliative care team when the situation gets so complex and there's so many different factors, there's so many worries. And I'll be sharing more about what that is. So, what is a palliative care team? So, palliative care team is usually a specialized medical care team. And if a family seems to be struggling with pain or even any other life limiting symptoms and is not receiving the support they need, you can ask the medical team to be referred to palliative care. So, palliative care is an extra layer of support, it's an additional support service, and it does not replace your current level of care. So it's additional and they join your medical team. And you can receive palliative care while receiving treatments for curative disease, even when you're receiving chemotherapy, even undergoing surgery. So private practices usually don't have palliative care team, but they can give you the contact information for a local palliative care team in your neighborhood or in your city. And it's usually made up of a doctor, a nurse, a social worker, and sometimes even a chaplain. And they try to treat the family and the patient in a very holistic physical, mind, body, spirit kind of way. And their main emphasis is to prevent or relieve pain and suffering and to improve the patient's quality of life, both physically, emotionally, and spiritually. And again, the palliative care, it can be received while attempting curative treatment. So even if someone's undergoing cancer treatment, they can still get palliative care.
So back to our story. It is now 3 years later, and Mrs. X has had 3 episodes of pneumonia and 2 falls. The family's focus at this point is on prognosis, caregiving logistics, emotional support, anticipatory grief support. bereavement support. The amount and level of care also comes up, and it's important again to communicate.
From the medical team's perspective, the focus is thinking about care options, especially when there's been so many episodes of pneumonia, there's falls, there's been surgery. They may ask, are you thinking of extending life with, intubation, CPR, or would you like to focus on comfort? They may introduce hospice, and the focus of hospice is quality of life. And they may talk of where hospice can be provided, either in a center or at home. Again, they will be talking of changing the approach of the care. And you may hear words like comfort care, and the spiritual care team may also start to visit the patient and the family. And again, the social worker here may also be really important. They might come in and start talking about, hospice team and what resources you need in terms of caregiving logistics, in terms of emotional support. So when it comes to communicating and advocating, you can ask about, resources for hospice. What does it mean? Where will it be provided? What are you worried about? Maybe you're worried about your loved one not being able to eat. Maybe you're worried about them being in pain. Who will take care of them if they're not able to move? So again, verbalizing all these worries to the medical team, and you'll be discussing options for what hospice care can look like. Again, I'll talk about hospice, but hospice is really focusing on end of life and focusing on comfort and relieving suffering. So what is hospice? It's a type of palliative care for individuals at the end of life. And usually a medical director makes the diagnosis that the expected life is less than 6 months or less. And it can be provided in a center or at home. And most insurance plans and Medicare covers hospice care. Again, it's an interdisciplinary team, just like palliative care team. There's a doctor, nurse, social worker, chaplain, maybe even a bereavement volunteer, and maybe a nurse's aide who come to the house or in the center and provide holistic care to you as a family and to the patient. Again, relieving suffering, easing pain, and providing support to the family.
So please talk about your wishes for care, communicate. With the story of Mrs. X, we hope you have an understanding of differing family and medical systems perspectives. Use this experience to think about your key values and wishes for care, starting now, as well as into the future. We want you to operate from a sense of control and agency. Communicating openly with your loved ones and medical team is critical, so your family's culture and values are acknowledged and wishes for care are honored by the medical system at any age. With self-advocacy, we hope that you will have a sense of peace within your family about your care. We're always trying to improve our program and want to hear your thoughts. Your feedback will also help us secure future funding to keep our programs free and available to the public. I encourage you to please take a moment to complete the survey. And you can find schedule information about live events, as well as great resources and so much more at the End of Life Choices New York website. Please follow them on social media and encourage your loved ones to visit as well. We would like to leave you with a few questions to help you with your thought process around thinking about what is important and defining your values a little bit more. One question that we would pose that might help you think about some of these values as well as wishes is to ask yourself to think about what is advice you would give to one of your younger selves. That if you could go back in time with all of the knowledge that you have now, and you could visit yourself as a younger person at some point in your life, any point, what kind of advice would you give to that person?
Thank you, Tita.
And one question you can ask yourself is also, what makes a good day? What brings you joy? What is life worth living for? And you can bring this question to your loved ones and have a discussion on, again, it's an individual experience of what is a good day, what is a good life for all of us. I hope the information we provided here today and these questions will add to that rich conversation with your loved ones. Thank you for being here today and joining us.
Thank you.